HealthBreak is brought to you by Providence.
Older Americans are staying more active than ever before, especially here in Montana. And that's one reason why advanced joint replacement options are so important. Dr. Cam Barton talks about the Anterior approach he uses at Providence St. Patrick Hospital for hip replacements.
It's a small incision just on the front aspect of the hip. And there's basically a nice muscle plane where we don't have to do a lot of muscle dissection or cutting of the muscle. There's some studies that show it may be a little quicker recovery for some patients. And it's a very stable approach. There's a lesser chance of that new ball that we put in popping out of place, and that's called a dislocation.
And Dr. Barton offers what is called a partial knee replacement.
There's varying ranges of how, severe that arthritis is or how severe the wear and tear is. Some patients, they don't have a lot of cartilage loss. A partial knee just basically resurfaces that part where it has become that bone on bone. Most commonly, it's on the medial aspect or kind of inside aspect of the knee. And it's a pretty small implant. It's usually quite a bit quicker recovery. It's a smaller incision, just less surgical trauma. And therefore, patients are usually able to get back recovering quite a bit quicker and back out hiking and doing the things they like to do in Montana a lot quicker.
To find out more, visit montana.providence.org.
HealthBreak is brought to you by Providence.